Hi, I'm Dr. Phillip Yoo from Southern California. I am the president of the 21st Century Laser Stem Pain and Regenerative Medicine Institute. So I flew all the way here to Washington, D.C. to partake in the Alliance for Regenerative Medicine Congressional Luncheon to lobby for support to advance the research and approval of regenerative medicine. We know that there's a failed medical model in the U.S. based on just allopathic medicine. We know that the opioid epidemic has caused a lot of overdose and deaths and side effects of the medications and a lot of these failed surgeries. And what we're here is we want to advance the field of regenerative medicine. Encompasses a lot of different therapies. Obviously stem cell therapy, cytokine therapy, growth factor therapy, photobiomodulation, the use of light-emitting diodes and laser technology to increase your body's repair capacity, pulse electromagnetic field therapy, which also stimulates your body's endogenous stem cells to repair, nutrition. One buzzword is biohacking, which is basically using energy and nutrition and manual therapies to stimulate the body's natural, God-given repair processes, if you will, or your innate body's ability to repair itself. The main mechanism the body repairs itself is we're born with a certain amount of repair cells called the MSC, medicinal signaling cell, or mesenchymal stem cell, which signals your body to repair itself when it wears out. So as we age, instead of degenerating, these cellular therapies and regenerative therapies allow your body to regenerate, which really doesn't have any side effects, a natural approach to get Americans healthy, out of chronic pain, solve the opioid epidemic, and really prevent all these unnecessary cortisone injections. Cortisone basically destroys the joints and basically rebuild the body and prevent all these unnecessary surgeries, leaving a lot of Americans disabled. We are partnering with the NFL alumni situation. We know a lot of retired pro football players that are broken from their careers, as well as many pro athletes. A lot of them are left behind. We know the concussion issue in the NFL, that's a big issue. Traumatic brain injury, again, addiction to opioid drugs. A lot of these athletes, there's no workman's comp coverage or disability. We want to fight for their right to have regenerative medicine covered by their insurances, team owners to sponsor them, so they don't just get care when they're playing on the field. We want to take care of the players on and off the field. We also sponsored a UDT Navy SEAL Association Veterans event. We treated over 60 veterans and their families. A lot of these veterans are also left behind when they retired, denied disabilities. This should be covered by the VA, the TRICARE insurance for active duty, and not only our pro athlete and military veterans, but Americans in general as well, our weekend warriors, the general public. Autoimmune diseases on the rise. Number one cause of death in the U.S. is actually iatrogenic diseases, side effects from drugs in the hospital, MRSA virus infections, autoimmune reactions from injections like cortisone, or failed surgical procedures, which can cause an infection, blood clot, or the hardware can fail, leading to more surgeries in the future. Again, second cause of death in the U.S. is cardiovascular disease. We want to educate our patients on proper nutrition, lifestyle, stress management, and of course number 3 is cancer. Again, we want to control people's lifestyle through exercise, proper nutrition, manage their stress levels. There are a lot of alternative therapies other than dangerous chemotherapy, radiation, and ectomies, which are the traditional methods to treat cancer. There are a lot of adjunctive natural therapies which could augment that to make it more successful. So, again, we do research on a lot of countries that they don't have all these degenerative diseases Costa Rica, Italy, Loma Linda, California, Okinawa, Russia. A lot of these places don't have these cancer, these iatrogenic, diseases or these cancer rates like us because they eat a certain way. We need more omega-3 fat in our diets. We need to decrease our statin use. We got to decrease our cholesterol naturally through nutrition, exercise. Doctor does not mean God complex. It means teacher. So we want to, as doctors, we want to teach our patients how to take care of themselves through nutrition. Apple a day keeps the doctor away. It's true. But we've gotten too much into chemical-based medicine. Too many pesticides, herbicides, antibiotics in our, animal proteins in the vegetation. We got to ban all these GMO foods. We got to ban all these pesticides like Roundup, which has glyphosate, which is a carcinogen. We need more research to expand the natural therapies. The reality is, if it's banned in the US, people are going to fly overseas to have it anyways. Where do you think Jack Nicklaus had stem cells when he couldn't even golf because of chronic back pain? He flew to Munich, Germany. He saw Dr. Eckhard Art. He's part of our association, American Academy of Stem Cell Physicians. Does he have the best insurance in the US? I would argue yes, but he couldn't be helped. Went to Germany, got stem cells, now he's golfing pain-free, playing tennis again. Where do you think Peyton Manning had his stem cells? He went to Europe, came back, won the Super Bowl at age 39 for the Broncos. Now these guys can afford to fly in their private jets, fly to Europe, pay a bunch of money to have stem cells. The average American cannot. So a lot of them go over the border to Mexico to have stem cells, where it's out of the FDA's jurisdiction. We don't know about their safety standards. It's very dangerous. Bottom line is billions of potential tax dollars and revenue are going out of the country. They're going to Asia, Europe, Mexico, Central, South America to have these regenerative therapies. Russia, the Russians, the Swiss, the Germans have been doing stem cell regenerative medicine for over 100 years. Folks, we are over 100 years behind in stem cell research. Already, the Japanese, the Koreans, the Chinese are 10 to 15 years ahead of us. And if we don't invest in the promise of regenerative medicine, which is safe and effective and ethical, we'll be left behind in the future of medicine, which is regenerative medicine. Anyways, that's my soapbox. I didn't come here for my health. I came here for your health as Americans. It wasn't easy getting here. I have a family in California. I just came here, moved my patient schedule, because I believe in this mission to get Americans out of chronic pain, dysfunction, autoimmune disease, inflammation, and get back into a pain-free, active, functional, and healthy lifestyle. If you look at the Bible, Moses died at 120, but also said his eyes did not fail him, neither did his strength fail him. We're designed as humans to live to 120, not in a wheelchair, not with poor vision, with just general vibrant health and strength, functional, so you can enjoy your golden years. Anyways, it was a long soapbox, but I hope you got a lot of the information, just speaking from the heart in the Hart Building. So thank you for watching. We'll give you an update on how the congressional hearing goes. Thanks for watching. All right.